പിന്നെ നല്ല സെഷനുമായിരുന്നു. ആദ്യത്തെ ഒരു ഹാഫ് ആൻ അവർ ഞാൻ ഉണ്ടായിരുന്നു. അപ്പോൾ നല്ലൊരു സിംബോളിക്കായിട്ടൊരു വിഷയത്തെ കൊണ്ടുവന്നിട്ട് സയൻറ്റിഫിക്കായിട്ട് അവർക്ക് അത് അവസാനിപ്പിക്കാൻ സാധിച്ചിട്ടുണ്ട്. കിച്ചണിലുള്ള വേസ്റ്റ് ബിന്നിൽ നിന്നും പുറത്തു വരുന്ന പിന്നെ സ്മെല്ല് സ്വാഭാവികമായിട്ടും നമ്മുടെ ഭക്ഷണത്തിൻ്റെ ടേസ്റ്റിനെയും ഭക്ഷണത്തിൻ്റെ സ്മെല്ലിനെയും അതോടൊപ്പം തന്നെ അതിൻ്റെ അബ്സോർപ്ഷൻ, ന്യൂട്രീഷ്യസ് ലെവലുകളുടെ അബ്സോർപ്ഷനെ ബാധിക്കുന്നു. അത് അതിൻ്റെ ഒരു മൂന്നാമത്തെ തലമാണ്. എനിവേ അത് കൃത്യമായിട്ട് നമ്മുടെ മൈൻഡിൽ കൊണ്ട് നടക്കുന്ന നെഗറ്റീവ് തോട്ട്സ് ഇതുപോലെയാണ് നമ്മുടെ കംപ്ലീറ്റ് കാര്യങ്ങളെയും ബാധിക്കുന്നത് എന്നുള്ളതൊക്കെ കൃത്യമായിട്ട് എത്തിക്കാൻ സാധിച്ചു എന്നുള്ളതാണ് ഒരു പോയിന്റ്.
Good evening, respected dignitaries on the panel and all other faculty members of the special time, our chief guest, Mrs. Aliya Patel, and all other members of Iagc and dearmost students from various places. And I'm very happy to be within the special time because we people are discussing more about psychology in many time. And at the same time, we are delivering good speech from different panels. And today, our eminent personality and our chief guest, Mrs. Aliya Patel, will deliver a good speech regarding well-being. So here, Mrs. Aliya Patel will deliver a speech and discussion about well-being. And everyone knows the phrase of psychology well-being is used to describe an individual's emotional health and overall functioning of a person. Our eminent faculty, Mrs. Aliya Patel, is here and she is giving much importance and a good decision about the well-being and what criteria we done at the same time happy, and at the same time we want to functioning more about that word and how we can create happiness in the world. So many times we are all discussing about applied positive psychology in our life, and our chief guest will decide and deliver a good speech regarding well-being. So here I hardly invite or lovely invite our faculty, Mrs. Aliya Patel, in this special time. Ma'am, are you here?
Yes. Good afternoon. Good evening. Assalamu alaikum.
Hi, ma'am.
Hi. Hello. How are you, everyone? And
Fine, ma'am.
thank you, Dr. Shameena, for introducing me, and the other honorary guest, and the panel discussions and the panel advisories to give me this opportunity to give a little bit clarity to our hardworking students about what is psychology, what is psychological well-being, and the difference between psychotherapy, life coaching, and counseling, and of course, mentoring. So I hope there is much clarity who I am and from where I am. So should I start with the session?
Sure, ma'am.
Okay, so I just wanted to request a host if there is any PPTs being shared around or any slides are there which are going to be presented.
Oh, sure.
Yeah.
Actually, they need more information regarding well-being, ma'am. So we can discuss and we can deliver more about that topic.
Okay, so the whole webinar is about today's is psychological well-being. Now, what is psychological well-being? But before that, I just wanted to ask Doctor, is this session we are going to be making it interactive, or the students are just going to be listener?
Most probably we can use interactive session because then only they can interact you, and so many people are ready and they are eagerly waiting for your interaction. So
Sure.
we can throughout the session we can make interaction, ma'am.
Okay, so yes, let's go ahead with what is psychological well-being. Now, why this is such a big thing or becoming a big thing in this today's globe, that we have to take care of our mental well-being. Now, mental well-being sounds as if you are suffering from some disease, some kind of an issue, which is sometimes in Indian culture sounds as if it is more worse than cancer, but it is not. It is not. And it's a dilemma all around the globe that talking to a counselor, communicating with a psychotherapist or a life coach for oneself is not good for our health, is not good for the societal status. Societal status comes into interaction. And what we do, we don't communicate because of the societal status, because of this dilemma, because of the culture that we should not be vulnerable. We should keep everything within ourselves, and we should be only giving it to the one who are very nearer and dearer and must be taking their feedback. And most of the time, the nearer and dearers are our well-wishers most of the time, but their feedback doesn't suit to our emotions. Their feedbacks are always into judgmental. Their feedbacks sound as if they are not trustworthy for us. So, whom to approach and why to approach? We must always go and approach to some professionals who are non judgmental, who are trustworthy, who are highly confidential, and who will keep it within, and their feedback will be neutral, who don't know you as a person, who don't know you, your behavior, who don't know you by birth or by relation or by any professional platform. They know you as what you are in the moment, and these are the professional known as from by different names as psychotherapist, psychologist, psychiatrist, life coaches, and counselors. And we must approach them for our psychological well-being. What is psychological well-being? Everything here is in the head. Everything here is in the head, wherein I'll just give with an example. Like we all have a dustbin at our houses, at our homes, at our rooms, in our bungalows, everywhere we do have. Why these dustbins are kept? So that every day we throw some dust into that bin, and every morning or evening we can throw it out to the particular department who comes and collect the dust from our house. Now imagine if you keep that dustbin full of dust, full of dirt in your kitchen, in your bedroom, or in your lounge, in your living room, and you are having your food, your breakfast, lunch, dinner, smelling, taking the smell in that ambience, in taking the smell of the dust which is collected from since a week, a month in your house, in your room, in your kitchen, will you be able to have your breakfast, lunch, or dinner peacefully in a good ambience? Can anyone answer me this? Would it be possible for you?
No, ma'am.
Yes, it won't be possible. Why? Why it won't be possible? It won't be possible because it will stink. It will make us filthy. It will make us like to vomit. It will make us to. Yeah, sorry. So it will make us feel filthy, vomit, and uneasy to breathe, to take the taste and to take the smell of our freshly cooked food, which is there for our breakfast, lunch, or dinner. And the same goes with our mental health. So there is so much. A brain is, subhanallah, brain is by the grace of Lord, is such a great, is such a special organ in our body, which is given to us by the Allah, the Lord, the God. And this brain is filled up with so much that we have thoughts, we have emotions, we have feelings, we have so much into it, and everyday task and routine, and some memories of the past, the more of 10 years back, more of 20 years back, subhanallah, more of 5 years back. And now it and these memories keep coming, memories keep clicking in our head with the today event. So most of the time it also happens. See, I hope you all will relate. like you are on a holiday and you are feeling hungry while you are going for some sightseeing, and there comes a beautiful and nice ambience, and with a very nice food smell, and you feel like, oh, you go into a memory of your past. You go into a memory of your past. Oh, my mother used to cook such food. This smell is same relatively to what I used to have during my childhood at the age of this. So these are what? These are memories connected to our senses. And that's how our negative, positive, not so good, not so bad, all the rational, irrational memories are connected in the moment. We are doing it something in the moment, and something clicks of the past, maybe a week back, a month back, a year back, or years back. And this is why we have to take care of our psychological well-being. We must go and talk to someone, even if it is a happy memory, even if it is a sad, even if it is some irrational, or even some memory which is triggering us, giving us some negative thoughts in the moment. We need to go and talk to someone to progress with our future. So that's how we will empty the dustbin, by not letting it stink in ourselves, in our brain, in our body, to make it more worse for our future progress. And how the future progress, the breakfast, the intake of the breakfast, lunch, and dinner in today's, in the moment, which will help us to grow in the future. So whatever you are consuming by your mouth, or by your head, or by your, by your eyes, or by your ears in today's moment, will definitely be worthy enough to allow you to move further towards your goals in the future. And that's how psychological well-being help us to grow, not only by age, but by our mental well-being, by our personality, by our skills, by everything we do for the betterment of ourselves and for the betterment of the society. If we don't go ahead with our well-being, then what happens? Then we age by number, and the body takes up that number, and it starts going backward. It starts going into problems, into disease like thyroid, diabetes, like Alzheimer's, like skin irritations, like migraine, all such things which are like, it triggers us, and we want to come out of that, then we cannot. So that's how cycle well-being does not only helps our personal growth and physical growth, but it helps our body autonomy also. It helps us to grow further. And that's what make us a complete human being, to achieve our future goals, to go forward. Now, coming up to what is the difference between psychological well-being, a psychiatrist, a counselor, a psychotherapist, a life coach? These are definitely different names of the professional people. They are being trained, certified, and some of them are degree holders in their respective field. Psychiatrists, as per my knowledge and as per my understanding, psychiatrists are the degree holders, they are the doctors. They are the doctors, they have given their hard earned life, efforts and time and energy towards into their research, into their well-being of the people around the globe. And they treat patients mostly with medications or through medications. And on the other hand, psychotherapists are clinical, non-clinical, life coaches are clinical, non-clinical, and counselors are certified and trained. Now psychotherapists are also degree holders, and if they achieve their masters and PhD, then they get a doctorate degree with their research and with their hard efforts. Psychotherapist believes in non-medication. They believe in more of therapeutic work. Now, for example, here I would like to give an example which I mostly use in my sessions. Like, somebody met with some accident, I would say bone injury, and we go to a we go to an orthopedic for a bone injury. The orthopedic is a surgeon, he treats us, and then he gives us medications and XYZ. Then he recommends us the physiotherapist. Why does he recommend us a physiotherapist with an operation done, with a surgery done, with a medication done, everything? So that the physiotherapist will make us do some exercises for the movement of the body, the physiology of the body, for the moment, to make us go smoothly, run, walk as we used to do earlier before we met with an accident. And that's how a psychotherapist work with our brain, with the brain of the client. They give us several exercises. They give us several mental well-being exercises where we will start thinking. Our brain will give us that conscious awareness of those thoughts, of our emotions, of our feelings, so that we can observe ourselves in the moment to move further with our future progress, with our personality, with our emotional management, wherein emotional management is given the first priority. What happens when we are not talking to someone? We are consuming everything, the body shaming by other people, or the labeling, or the controlling, or the dominating nature, or become a victim of any kind of circumstances. What happens? We fight, we struggle within ourselves with our emotions. What are emotions? Emotions are our feelings through which we express ourselves. Some days we get up in the morning and we are really very happy. We feel very good. Wow. Subhanallah, Alhamdulillah. Thanks, by the grace of Lord, this day is too good. We inside, these are the feelings we come out. We don't speak out loud, but we come out with such feelings. And by the time, till the afternoon, with our daily routine, with some XYZ work, we feel like, oh, suddenly what happened? I'm not feeling so good. And I'm not feeling to answer the WhatsApp messages. I'm not feeling like to call up, give an answer to anyone on the call. I feel like shut down everything, and I don't know what happened. Suddenly I want to take a off or a half day from my job or from my office. I don't know. And suddenly I don't feel like doing my homework or my assignment or my research. What are these? These are our emotions which suddenly arises. Now, why there is an arise of these emotions in a sudden moment? Yes, it's our brain. As said earlier, anything can trigger in the moment. Any past reflections can come in the moment, and anything can happen in the moment. As given the past example, the smell of a food can make us remember our parent or grandparent, or our childhood memory can come back. So our senses are very strong, and it can give us a touch of those emotions to our present moment. And then we and then what happens when our emotions are disturbed? What happens? Wow, we cannot manage it. We don't know how to manage it. And sometimes it takes weeks. That sudden trigger of some thoughts take weeks. a week, 2 week, month, 2 months. And then suddenly in those weeks, we go into anxiety with other things. We go nervous with other things. If we have an interview or we have to submit a assignment on a due line, or we have to have relatives coming up, we suddenly go into some kind of anxiety, some kind of self-doubt, some kind of limiting doubts in ourselves. And see how the chain works of our emotion and takes us from that one moment of the afternoon till the next coming weeks and months. And then it incorporates with other circumstances and phases and situations of our life. And then one fine day we are into so much of anxiety, so much of nervousness, so much of sweat, and then we cannot face. And some friend or some family said, what happened suddenly? 2 weeks back, I was doing some work. I got up in the morning, I was fine. And in the afternoon, something happened. I don't know what happened, what triggered me. And I had a breakdown and I cried and still I don't understand what I'm going through. And now from that day till now, I am just losing up my confidence and I'm feeling not to do any kind of work, blah, 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 blah. Can anyone relate to these kind of statements? Can anyone answer me? Can anyone relate to these kind of statements?
Yes, ma'am, it usually occurs.
Yeah. So we all, it usually occurs for every one of us. So what we should be doing it?
Yes.
We should be taking up a counseling appointment with a psychotherapist, with a counselor, or with a life coach. And it depends. Now, if we go to a counselor will help us to hear. They are empathetic listeners. They hear us without being non-judgmental. They hear us without being not confidential. They are so highly confidential that they will not give our details to anyone unless and until the client is into so much of depression or trauma that they say that they are going in suicidal thoughts. And that's where the counselor or the coach or the psychotherapist feels the need of talking to the client's family. Now that depends on how severe the client's condition is and how many sessions they have taken. Now, years of problem in our head, years of. Some have their childhood problems, some have their teenage problems, some have their adolescence from this since the time they were into teenage, since the time they were into adolescence, since the time they have married, or since the time they have accomplished with their professional degree, or they went for some entrance exam. Now how we will come to know? We will only come to know when we will seek help. When we will seek professional help, not help from our friends, not help from those who are not professional, who are our well-wishers, who are our friends, who are our family, not from them, but yes, from them, those who are professionals. And these professionals, they do have certain framework. They work under certain framework. What are their framework? To repeat again, they take by appointment. They have certain fees. They work with confidence under some ethics and regulations, with empathy and with trust, with honesty, and within the client's framework also. Within the client's framework also. what the client needs in the moment, what the client want in the moment, what the client want to talk. So for the first time, if we are visiting to a counselor, life coach, or psychotherapist, we have so much to say. We have so much to say. And what the psychotherapist, life coach, counselor, these professionals do, they funnel down. They hear us. They help us in creating our goals, not one goal, but goals. And they make us build strategical steps to work towards our goals while managing our emotions, or while learning and developing strategies to manage and learn and manage our emotions. I would put this way, to learn and manage our emotions. Emotional management is very important. And once we learn that, and once we know how to manage that, then we can grow. And then we don't need any counselor and psychologist and psychotherapist. So it's not a shame to go to a psychotherapist or a life coach or a counselor. It's not a shame to go to them. It's as good as you are taking care of your mental well-being, is as good as taking care of your health. You suffer a viral disease. Every year in monsoon or in winter season or in summers, we do suffer a viral. We all go through some kind of sneezing, coughing, body ache, headache. Do we treat ourselves on our own? If we are into high fever, do we go with home remedies? Do we go with what previous year the doctor has prescribed the medications? No. Because every year we grow. We age every year. Our body hormones changes every year, every minute, every second. And we don't know what is the anatomy of the body inside, how it's working. So when we are into a small viral fever, we all know we go through that. And so what we do, we go to a doctor. In the initial phase, we don't go to a specialist. We don't go to an MD, but we go to an MBBS, who is a general physician. And we ask the doctor that we disclose our symptoms to the doctor. And then we take some medications, and there is a course given by him for 5 days or for 2 days. And then the doctor says that, after 2 days, come and see me again, or after 5 days, come and see me again, only if the fever doesn't go away. And we do visit, even if the fever goes away, but the cough is still there, but the sneezing is still there, we do go to the doctor. The body ache is still there, we go to the doctor, and we fulfill that course of time. And what about our mental health? Why we take it so loosely? Why we take it so lightly? And why we let it go? It also have symptoms. As I mentioned, the symptom of sudden breakthrough in the afternoon. And there are many small symptoms, tiny symptoms. Feeling sleepy, too much sleepy sometimes. Feeling lethargic, lazy. Feelings of not doing some work. Feelings of procrastination. Okay, I can delay this now. The due line is after a week. I can do it when the due line will be near. Sometimes feeling of not talking to anyone. Sometimes feeling of not having food on time, or not having our favorite food, even if it is our favorite, and even if it is freshly cooked. Body pain, back pain, sudden calf pain, sudden headache, sudden breakthroughs on the face, on the skin, sudden itchings. These are also symptoms of unhealthy psychological problems or unhealthy psychological issues. And it is very important for us to communicate rather from with our well-wishers to the professionals who are available and who work according to their ethics. So trust yourself and trust the professional platforms and go ahead and connect with them. And it will not be easy. I understand that it will not be easy, and it's not also a part to fulfill it in an hour. Oh, I have taken an appointment of a professional platform. I have taken an appointment from a professional platform with a professional, from a life coach or from a counselor, and I have paid so much of rupees or dollars or dirham or reals, and I'm giving up an hour, and what she did or what he did, she or he just heard me, that's it. They did not give me any clarity about what I have to go ahead, and it's more than I cannot afford more than 1 hour. My time is important, I cannot put up my time. No, my dear sisters and brothers, it's a process. The next step is to follow a process, like how we followed a process of the medications given by a general physician for 5 days, for 2 days, and again we revisit them. If we don't get cure from that 5 or 2 days of procedural medication, prescribed procedural medication, then what we do? We go ahead to a specialist. We go to an MD. We get our X-ray done, chest X-ray done to see if there is congestion. We go into several blood tests, pathological tests, I would say pathological test. And then we follow a process which takes time. And then finally a doctor, being an MD, being a specialist into that particular field, takes time to study, to go through that report, and then prescribe us medication with again a process of a month or 15 days. And that's how the psychological health is also, the well-being of the psychological health is also a process. It's not an hour session. It's not an hour session. In an hour, you want to discuss your whole life of 10 years, 5 years, 3 years, 2 years, 1 year, 1 month, 1 week. You want to discuss everything in an hour. And the counselor, the therapist will hear you, will put his or her full focus on what you are saying, what you are feeling on your face, on your hands, in your eyes. The therapists observe each and every little minute attitude and behavior and the words and the saying of their clients. And it's not an hour session. It is a process. At least it takes 4 to 8 to 12 sessions to come into a strategical plan, step-by-step plan of getting and learning our emotions and practicing it to manage it. And then while doing that, trying to achieve our goals, short-term or long-term. And once you have learned that, you have practiced that, you are on the go. You are on the go to achieve. And in future, if you face another phase of life, another situation, another problem which can give you a trigger, you at least know the first step how to manage your emotion, because you have done this previously with consistency, with a follow-up, with a process, with a consistent process. You have done this. So now in the present moment, in future, after achieving your first step, you know how I can move further. And if the situation is difficult, it's okay to again take an appointment and to deal with it. Because the dustbin is never going to be empty. There will always be filtered, there will be always be dust. Now, after these sessions and after the understanding of our emotions, learning it, adapting it, taking it into a consistency habit, we can filter the dust of the dustbin. We can even do that. What is required in, what is not required out, what is required in, what is not required out. Throw it out, throw it out. This has to be in, this has to be throw it out. And this is how we can have our future growth, by not only by our age, but by our behavior, emotions, personality, our brain, our mental well-being, our skills. We can grow in that manner. I will take a pause for a minute, for a second. Do anyone have questions so far? Okay. So I believe I am clear and everyone is getting me till here what I was talking all about.
Yes, ma'am.
Thank you. Thank you for giving
We
your
can follow you very clearly.
Thank you. Now, what happens? What happens when we go into a therapeutic session? How does it benefits our future? So I said just earlier, a minute back, that it helps our personality, it helps our growth, just not by age, but also by behaviors and emotions. It gives us, a strategical plan. It gives us an empowerment. As said earlier in the beginning of the session, that we have so much, one emotion so much incorporates the other emotions and it keeps carrying on. So as given the example earlier, suddenly we got up in the morning and sometimes suddenly in the afternoon we feel uneasy, and that keeps on carrying, and we fall into anxiety and we fall into some other kind of triggers and problems and nervousness and etc., etc. And what happens when we take up counseling psychological sessions or coaching sessions? We start believing in ourselves, because we start managing our emotions, because we have followed with the procedure and process with a consistency, and we have started practicing. So we start believing in ourselves. Earlier, what used to happen? Earlier, we used to go into more anxiety and traumas and nervousness. And in between those days, if some friend comes up and if some friend says, some kind of put up a label to us, like, oh, you don't look this color doesn't look good on you, or this hairstyle doesn't suits you, or you look very bad with this specs, don't keep wearing the spectacles. That hurts more. This friend has said this used these terms earlier also, but it never felt it so bad. Now it's feeling it so bad that he's labeling us. So these kinds of things comes into our ear and it goes into our mind, wherein we cannot control our emotions, and then it reciprocates to our well-being, not only at home but also in the college, in the universities, or in the office places, in the workplaces, in any area of our life, in the relationships, while in parenting. Parenting is the biggest thing, and workplace is also biggest issue, where we lose a lot of uh, what would I say? The right word is we lose our in parenting. We lose our loved ones. We give out so much of bad energy, negative energy. And now once we are into the cycle and process of following up our coaching and therapeutical work, while into communicating with a professional and working on ourselves, we get empowered. We understand what we have to take and what we have to throw out. We understand how we can manage our emotions in the moment. So emotions are every time, everywhere, every second, every minute, every hour. We understand how we can manage it in the moment suddenly. So previously the emotions used to take us for 2 weeks, for 15 days, for a month. Now it will reduce to a week, then it will reduce to 3 days, then it will reduce to 2 days, then it will reduce to one day, then it will reduce to few hours, and then it will reduce to an hour. And then that's how we will learn how to manage it. So if somebody is saying up, labeling up something or criticizing us, which we don't like, and in that moment we are triggered or we are into some bad mood due to some or the other circumstances or issues going on in the present moment, we will not affect our health, our mental well-being by that person labeling us. Why? Because we have already gone through that phase. We have followed the process of therapeutic understanding, and we have done it with consistency, and we are still practicing it. So now we know how we will move further with our future accomplishments. And what is this known as? This is known as empowering oneself, believing in oneself, holding up oneself to an accountability that if I am crying, this is because of me. If I'm happy, this is because of me. If I'm angry, this is because of me. Because now I am managing my emotions and not letting anyone manage my emotions or overpower me. It's like I am driving my car. I am holding up my steering of my car, and I will be driving it to the path where my destination is, and I will be going. I will not let others hold up the steering of my car and drive me, so that I come into a zigzag rock and roll position and will keep on screaming throughout my life. Because we don't scream by our mouth, but the mind screams. The mind screams out loud and a lot when things are not in our control. And what we can do is the best to control ourselves, our emotions. We cannot control others. We cannot control others. We cannot control the emotions of others. We cannot control the tongue of others. We cannot control anything. So again, an example, and if it is a monsoon season, if it's raining, Can we control the rain? No, we cannot control the rain. What we do? We carry an umbrella. We wear a rainy wear. But we do travel. We do go to our offices. We do enjoy our day. We do spend it as we want to. But we cannot control the rain. So, what happens when we are in a therapeutic sessions? When we take up counseling, coaching sessions, we get tools like the umbrella, right? The rainy wear. We get certain tools to manage ourselves, our emotions, our behaviors, our attitudes, our words, our communication. Instead of saying, I cannot do this, we start saying ourselves, I can do this. It will take time, but it's not impossible. We start reframing our verbal transactions within ourselves and with the others, so that what we have gone through or what hurts us, these statements from others, will not hurt by us to someone else. So we start communicating in a manner with others so that we are not hurtful by our verbal transactions to others also, or with others. So much and so many changes occurs in our lives when we take care of our psychological well-being. That is so important. The only one thing is we just need a first step forward of adaptability towards change. First step forward of adaptability towards change, and then follow it with consistency, with dedication. And then the world is beautiful for us, within us, and towards others. So far, any questions? Any questions by any participants? Please come forward and you can put up your questions, or you have to discuss anything, you can put up for that as well.
Ma'am, every time, you said every time we use, can you hear it?
Yes.
Every time.
Yes, yes, yes.
Every time can every time we use an umbrella or coat? Every time, every occasion.
So as I've given the, yeah, go ahead. Go ahead.
Is it difficult? Every time. Sometimes we became so sad.
Yeah.
Sometimes we became so sad. We can't overcome it. Not all the time. Isn't it?
Yes.
That is the problem.
Yes. Yes. So sister, for your, it's a good question. And for your question, there is an answer. I hope I have understood your question and I will answer you this. So yes, now here, when we have a child, or when we were a child, when we were kids, we took up admission. Our parents sent us to an academic schooling, and it starts from level 1, level 2, or junior KG, senior KG, nursery, junior KG, senior KG, level 1, level 2, 3, 4, and that's how we progress further in our lives. And accomplishing certain educational degree gives us a maturity level of performing or you fulfilling the performance in our lives with the education, with the academics, whether it is worldly academics or religious academics. We come to a level with our age to perform our lives with maturity. So what is this education? Education is a tool which helps us to perform our lives and our activities of our lives with maturity, with decency, with some kind of decision-making power, with some kind of understanding. And that's how this life coaching or therapeutic process, counseling process is a process. It's a process. That's why I mentioned it's 4 to 6 or 8 or 12 sessions. And in those sessions, you not only pour out your emotions, you learn and you adapt to manage your emotions. What you learn and adapt, you learn and adapt the strategies of managing your emotions. And then those learnings are your tools. Now you know how you can use these tools and how. Of course, not every time, because the situation demands different tools. The situation demands different tools. Sometimes we are into very bad phase of life. Sometimes we are into a very good phase of life. Or sometimes we are into a mid phase of life, which is okay, which we can manage. But at least in the moment when you are going through any phase of life, you are not connected to your past phase now, because you already worked on your past. You already took up sessions, you already worked on yourself, you already put up your time, energy, effort, and you learned and you cleared your head, you cleared the dustbin, you have poured out all the dirt. So now in the moment, if there is some situation which is not so bad or not so good, or it's so bad or it's so very much bothering, you will at least know that the umbrella is the first step. I can open it. I have certain tools. Let's try this tool with this situation. If it works, it will work. If it doesn't work, then I know where I have to go to.
Okay, ma'am. Okay. I try my best. Okay, ma'am.
Thank you. Hope I have given an understanding. Yes, Vijesh, thank you. Mr. Vijesh, your hand is up. Do you want to speak something? Okay. Now let's move further with the last step, how to seek professional help. Now all the past more than 30 minutes, we spoke more than 30-40 minutes, we spoke what is psychological well-being, how to detect it, how to go through, whom to go through. Now how we can. So we can, if we don't have anyone, we have our friends. If we don't want to talk to our friends, we have our family doctors. We can talk to our doctors. We can ask them if they know someone, a psychotherapist or a life coach or a counselor. If they are also unanswerable, then we have Googles, we have different platforms, we have support groups by the doctors on the Facebook, and we have support groups on Telegrams. We have different links, and I hope Iagc will give certain links and certain resources to all the students, to all the participants who are there. And these are the directories which we hold, and we can go through certain platforms, like how we have to take into consideration where we have to go and enroll ourselves, and whom to take care, whom to ask for professional help. So there are many platforms nowadays. You Google it, you get the names. You take the reviews on Google, you will get the help. And certain platforms offer a test and trial also, like 20 minutes or 15 minutes discovery sessions also. They ask you, okay, you can take it. And they also, certain platforms do charge you some amount of money and some don't. But there are many. and we can go ahead with that. It's not that there is nothing in this world, it's nothing available. A lot of things available. Like if we want some MDs or we want to, go for a diabetologist, what we do? We Google it, we go to the hospital website, we try to find out which is the doctor over there, or we call up our relatives or friends or neighbors or, any professional colleague or somebody. We call them and ask them, okay, I have tried this diabetologist and I want someone for my mother or for my sister or for my auntie. Can you recommend some good doctor? I'll just go and see how they are. I'll take up one consultation from them. So that's how we can search for ourselves as well. And with that, I hope there is a clear understanding of our psychological well-being and how it is important, and what is the difference between a psychotherapist, counselor, coach, and a psychiatrist. And if there are any questions, I'm here to take up the questions.
Hi, ma'am. I think you have done a very good session. So, and you told in by step each things with examples. So I think it is very clear what you mentioned and what you are up to. So thank you very much for this session.
Thank you so much. Thank you so much that I have been a part of this wonderful community, and I have got this opportunity to give you such a wonderful clarity on what is psychological well-being. It's a privilege.
Thank you, ma'am. Thank you, ma'am. A wonderful class. Very good class. You can follow it very clearly.
Thank you so much.
Thank you.
Hi, ma'am. This is Aliya, ma'am.
Yes,
Very happy to be in your sessions because the students get appreciative words from you. And everyone need a secular place and they need more comfortable place, actually. But if finding a comfortable place at the same time, somebody must not comfortable for that same position. So here your speech and you are delivering more expecting ideas regarding the same psychological well-being. So they are understanding that much points, and to the positive well-being of psychology must we need some positive regards in our mind too. So thank you for your wonderful sessions. Anybody have any doubt regarding the session?
Are you asking me something? Sorry, did I hear you?
Nazia, Kunnummal.
Yes, ma'am.
I got this in a link very late. That's why I couldn't understand properly. The last session, mashallah, understood. It's very good, very nice to manage the emotions. Thank you so much.
Thank you. Thank you so much. Thank you, everyone. Thank you so much for attending this session and being so powerful listeners and I've been privileged to, getting this invite to speak up on this panel. It's an honor, and I hope I keep giving such more sessions to such beautiful audience. Thank you so much. Thank you, Dr. Shameena.
Thank you. Point എന്താണെന്ന് വെച്ച് കഴിഞ്ഞാൽ നമ്മളെല്ലാവരും നമ്മുടെ കംഫർട്ടബിൾ പ്ലേസ് നോക്കുന്നു, പക്ഷെങ്കിൽ ദാറ്റ് ഇസ് നോട്ട് മച്ച് കംഫർട്ടബിൾ വിത്ത് അതേഴ്സ് എന്നുള്ളൊരു പോയിന്റ് വളരെ ഭംഗിയായിട്ട് അവർ പറഞ്ഞു വെച്ചു. നന്നായിട്ട് ഉണ്ടായിരുന്നു പ്രസന്റേഷനും കാര്യങ്ങളൊക്കെ. അപ്പൊ നെക്സ്റ്റ് ടൈം ഇതുപോലെ തന്നെ ശ്രീകല മാം
നല്ല ക്ലാസ് ആയിരുന്നു.
നെക്സ്റ്റ് ടൈം നമുക്ക് ഇതേപോലത്തെ ക്ലാസ്സുകള് കാര്യങ്ങള് ശ്രീകല മാം നമ്മുടെ പാരാ ഓക്കെ നമുക്ക് വൈൻഡ് അപ്പ് ചെയ്യാം.
താങ്ക് യു മാം. വളരെ നല്ല സെഷൻ ആയിരുന്നു. ഹലോ മാം. ഹലോ മാം. നന്നായി, വളരെ നല്ല ക്ലാസ്. അപ്പോ ക്ലിയർ ഓരോ സെന്റൻസും ക്ലിയർ ആയിട്ട് മനസ്സിലാവാൻ പറ്റുന്നുണ്ട്. അപ്പൊ നല്ല ക്ലിയർ ആയിട്ട് പ്രൊനൗൺസിയേഷനും ഒരു തടസ്സമില്ലാതെ ശ്രദ്ധിക്കാൻ പറ്റി. അതുകൊണ്ട് നല്ല ക്ലാസ്. താങ്ക് യു മാഡം.
താങ്ക് യു. നാസിയ മാമിന് സ്പെഷ്യൽ നന്ദി കേട്ടോ. ഇതിലെ റെക്കോർഡിങ്സ് ഉണ്ടാവും.
ആ മാം,
വൺ സെഷൻ ആയതുകൊണ്ട് റെക്കോർഡിങ്സ് ഉണ്ടാവും.
റെക്കോർഡിംഗ് അവൈലബിൾ ആക്കാം ഇൻഷാ അല്ലാ. പറ്റും.
താങ്ക് യു.
ആ മിസ്സിന് നല്ല എനർജിയാ, നല്ല എനർജിയുള്ള ക്ലാസ്. അതാ
അങ്ങനെയാണ് ക്ലാസ്. പക്ഷെ ശ്രീകല മാമിന് നല്ല എനർജി ആണല്ലോ. നന്നായിട്ടുണ്ടായിരുന്നു അത്.
മാമിന്റെ പ്രസന്റേഷൻ നല്ല
എല്ലാ സമയത്തും നമുക്ക് അംബ്രല്ല ഉപയോഗിക്കാൻ പറ്റിയത് വരില്ലല്ലോ എന്നുള്ളതാ.
മാമിന്റെ പ്രസന്റേഷൻ നല്ല രസമുണ്ടായി കേൾക്കാൻ. കേച്ച് ചെയ്യുന്ന വേർഡുകൾ മാത്രമാണ് ഉള്ളത്. നല്ല രസമുണ്ടായിരുന്നു കേട്ടിരിക്കാനും. അമ്മ കുറെ കാര്യങ്ങൾ ഉൾക്കൊള്ളാനും കഴിഞ്ഞു.
നമുക്കെന്നാ വൈൻഡപ്പ് ചെയ്യാം അല്ലെ? എല്ലാവർക്കും 8:34 ആയി. കറക്റ്റ് ടൈമിൽ അവർ അവസാനിപ്പിക്കുകയും ചെയ്യും. അത് ചെയ്യാം അല്ലെ? നമുക്ക് നിർത്തിക്കൂടാ?
ഓക്കെ.
ഓ ഓക്കെ.